Wisconsin's uninsured rate fell by 1/3 in the past 2 years, from 9.1% in 2013 to 5.7% in 2015. We went from 518,000 uninsured to 323, sixth best in the nation. Was this a victory for Governor Walker's decision to not take the federal cash and expand MA, but cover everybody below 100% of poverty?
Uninsurance rates have gone down nationwide, of course, because of the Affordable Care Act. It's no longer, you get penalized if you don't have insurance. So we've seen the uninsurance rate going down everywhere. Now, that's not necessarily a victory in of its own. And what we want to figure out is how we are expending health care effectively, whether we're actually purchasing value. Some exchanges have been working more effectively than others in the sense that they have not only more offerings on them, but they also have attracted more subscribers. So in some states, exchanges have been very effective in reducing the uninsurance rate, and some states less so. But there are other ways that the uninsurance rate has gone down also. And one way has been to try to figure out how to calibrate Medicaid expansion as well. So let me put it this way. Uninsurance rate has gone down everywhere. There are lots of different ways to get there. And ultimately, what we're really trying to do in terms of evaluating what policies are a success is try to figure out when value is being purchased. I think it's much more important than actually thinking about the uninsurance rate as a metric on its own. The uninsurance rate is a critical factor as it relates to social justice. You really want to make sure as much as your population has access to insurance as possible. That's the goal that everybody has. But it's not the only goal that healthcare policymakers have to have. We call it the triple aim: access, cost, and quality. But what we're really trying to do is not just expand insurance and protection, financial protection, but we're trying to make sure that we use our dollars effectively. So I would say that there are not many places anywhere, I'll say there's no place yet that can declare victory, because we still really haven't purchased value as predominantly as we really should. We need to make sure that we institute more reforms, more value-enhancing reforms to the delivery system. It's not just the uninsurance rate that we're worried about.